Good morning, and welcome to today's episode of Oncology Data Advisor. Today, I have the pleasure of being joined by Dr. Anna Baramidze, who is the head of the Clinical Research Department at the Totowa Clinic in Tbilisi, Georgia. At this week's World Conference on Lung Cancer, taking place in Barcelona, Dr. Baramidze is presenting an abstract titled Cemiplimab plus Chemotherapy versus Chemotherapy in Advanced Non-Small Cell Lung Cancer, 5-year results from the Phase 3 Empower Lung Part 2 trial. And today she's here to delve further into these results with us. Dr. Baramidze, thanks very much for coming on the show today. To start off, would like to introduce yourself and share a little about what you do?
Hello, so I'm Dr. Anna Baramidze from Totowa Clinic, Tbilisi, Georgia, and I lead the clinical research department. So my work centers integrating clinical practice with international clinical trials so that the patients in my region and my country can access innovative therapies.
Wonderful. Thanks for introducing yourself. So for background, would you like to give us a little bit of an overview of cemiplimab and its mechanism of action and how it's used in NSCLC?
Sure. So Cemiplimab is fully human monoclonal antibody targeting the immune checkpoint receptor PD-1 on T cells. And by binding to PD-1, Cemiplimab has been shown to block cancer cells from using PD-1 pathways to suppress T cell activation. So Cemiplimab is approved to treat certain patients with advanced non-small cell lung cancer and in several markets worldwide, and including first-line uses in monotherapy or in combination used with the chemotherapy as well.
Wonderful. And what is the Empower Lung 3 study investigating, and what are its kind of trial design and its endpoints?
Empower Lung 3 is a randomized multicenter phase 3 trial that investigated a first-line combination treatment of Cemiplimab and platinum doublet chemotherapy compared to platinum doublet chemotherapy alone. And the trial enrolled 466 patients with a locally advanced or metastatic non-small cell lung cancer, as well as squamous or non-squamous histologies across all PD-L1 expression levels and with no ALK, EGFR, or ROS1 aberrations. And the patients were randomized 2-to-1 to receive either Cemiplimab or placebo. And the primary endpoint was overall survival. Secondary endpoints included progression-free survival, objective response rate, duration of response, and safety as well.
Great, thanks for explaining. So what are the 5-year results that you're presenting at the conference this week?
I'm presenting 5-year follow-up results on overall survival from the general phase 3 Empower Lung 3 trial and highlighting progress in treating with aggressive cancer. So 5-year efficacy results with median follow-up of 60.9 months found Cemiplimab plus chemotherapy remained superior to chemotherapy alone, and with a more than double 5-year overall survival rate. And we have really impressive results. So 21.1 months median overall survival for patients treated with Cemiplimab plus chemotherapy versus 12.9 months for chemotherapy alone. And the 5-year probability of survival was 90% for the Cemiplimab combination versus 8% for chemotherapy, and 8.2 months median progression-free survival was with patients with Cemiplimab plus chemotherapy versus 5.5 months for chemotherapy alone. And objective response rate also favored Cemiplimab combination. It's 44% for combination versus 22% for chemotherapy alone, and 16.4 months median duration of response for patients treated with Cemiplimab plus chemotherapy versus 7 months for chemotherapy alone.
Great, it's exciting to hear about these impressive results at 5 years. Were there any differences in efficacy across the subgroups in the trial, and can these insights be used at all to guide patient selection?
What's important to know is that the patient in this trial had a variety of baseline characteristics commonly considered difficult to treat. So among enrolled patients in this phase 3 Empower Lung 3 trial, 43% of patients had tumor with squamous histology. 67% had tumor with PD-L1 less than 50%. And 15% had inoperable locally advanced disease not eligible for definitive chemoradiation, and 7% had pretreated and clinically stable brain metastases. So in an exploratory subgroup analysis, as a part of this 5-year follow-up, several benefits for patients regardless of tumor histology or PD-L1 expression as were evaluated, and specifically the median OS among patients with squamous histology was 22.3 months, and the median overall survival among patients with non-squamous histology was 19.4 months. So median overall survival among patients with PD-L1 greater or equal than 1% was 24 months.
Great to know. And what was the safety profile like, and did it compare with what was previously seen in the trial?
Safety profile at 5 years remained consistent with previously reported data, and adverse events of any grade occurred in 96.5% of Cemiplimab plus chemotherapy patients and 95% of chemotherapy patients. But when we're talking about the adverse events grade 3 and above, it occurred at 49 and 33% of patients treated with Cemiplimab plus chemotherapy and chemotherapy alone arm respectively. And among the patients treated with the Cemiplimab, treatment-related adverse events were grade 3 and more in 30%, and led to permanent discontinuation in 4.5% and death in 1%, compared to 18%, 1%, and 0.7% in arm where the chemotherapy was used alone.
Good to know. So putting these results into context a little bit, what are kind of the implications of these results, and does the 5-year follow-up data reveal any new insights about Cemiplimab?
These results add to the breadth of data underscoring Cemiplimab's utility as both a single agent and in combination with chemotherapy in advanced non-small cell lung cancer, as well as across a variety of patient types. So I want to add as a reminder that 5-year outcomes from the EMPOWER-Lung-1 trial studying Cemiplimab monotherapy versus chemotherapy in patients with advanced non-small cell cancer with PD-L1 high expression were presented at WCLC 2024, and it confirmed durable survival benefits.
Great. So how do you interpret the durability of Cemiplimab plus chemotherapy compared to other checkpoint inhibitor regimens in advanced NSCLC?
There are no head-to-head trials comparing Cemiplimab and other checkpoint inhibitors regimens in advanced non-small cell cancer, so I'm unable to make any comparable conclusions around durability. But however, we can say that I believe the 5-year data presented at WCLC 2025 reinforced significant durable improvements in survival outcomes from Cemiplimab plus chemotherapy in advanced non-small cell lung cancer.
Great. So now that there is 5-year follow-up, are there any remaining unanswered questions left, or any new directions for Cemiplimab?
We are continuing to analyze the long-term data from this pivotal phase 3 study with the goal of contributing additional insight that may help doctors to better understand how to treat patients with this difficult-to-treat cancer.
Great. Awesome. So as we wrap up today, anything else that you think the audience should know about these results?
Just what I want to emphasize is that 5-year results give hope to both clinicians and the patient that the long-term benefit is possible with the immunotherapy combinations.
Awesome. Well, thank you very much, Dr. Baramidze, for coming on today to share these results. Looking forward to hearing more from the conference as well.